Yeah, well, thanks, Terry. I was just thinking this week has been an enormous week, really, just things coming along and very relevant, I think, to what you're saying. And I think, my key message would be not to overthink co-production. It's a hearts and minds thing. People get really hung up on models and whether you need a ladder or whether you need and how engagement and involvement, all the rest of it. And it takes a lot of time and a lot of meetings, but actually you can feel it when it's really happening. And I think it's as simple as getting the right people in the room. And how do you do that? You do that by really caring about them and valuing them and being genuinely interested in what they have to say. And then listening to them and following up with them, not at them. And it happens very naturally. And you kind of see people come alive, I think, when they feel included and listened to and nobody is hard to reach. So in terms of the kind of things that you're doing with Fab NHS staff, and just a few examples from this week came to mind. So very relevant, I think. We did a maternity workshop in Coventry on Tuesday at the Coventry Building Society Arena. So a big event in Coventry and sponsored by them. So that's bringing your community in. They feel, instead of just clapping the NHS, to be part of actually delivering something back. We had this sparkly room. It started to fill up with mums and babies, and we'd asked people to think about making some pledges. Well, Henny, one of the midwives, I'd asked her to make some pledge cards, and they say, have you got an example? And I said, well, really, it's just something that people can write a pledge, but it's nice if people personalise those. So I won't tell you, this is a template pledge, just see what you come up with. Well, honestly, she's got them. I don't know if you can see them here. She came up with colour-coded, the 4 colours of whose shoes, hearts for people to write on. And you can feel that a little bit of love's gone into that. And, it's a nicer thing for people to write on. And the whole event was around well-being and recovering after the pandemic, but listening to everybody. So obviously, to have a baby during the pandemic and not be allowed to have your partner there, and perhaps even not have your mum able to come and help with a new baby, it's traumatic. But the midwives and the staff and the local like volunteer centre, they were all sharing their stories about just reflecting together, but then with a positive kind of emphasis in terms of what we can now do together. And just what we were saying, I think, before we started, in terms of what's actually been a good thing, perhaps a bit more flexibility, and what can we hang on to, and what can we all learn from each other. And it was just such Anna, the graphic artist, had a little helper aged 15 months who loved her pens, and the kind of, she was doing her report back with people looking after each other's babies, and just that humanity in the room. And it was so special, really. So I think for people to make pledges, it doesn't need to be a big deal. But for me, when people make pledges, we can just exactly what you do with Fab NHS stuff, connect with each other and help each other. So one of the pledges that came from the Coventry event was better access for parents for language support where English is not their first language. Now, immediately within that room, there were people who could help with that. And then, as I think I recorded a podcast with Rachel Grimaldi. So I'm mentioning Carb Medic, and the innovation lead for the hospital was there. And they said, well, actually, we're talking to Carb Medic. And you could suddenly feel that things were going to happen as a result of someone just writing that simple pledge. So then other people come on fire and they think, well, I can do something as well. So I guess that's the kind of spirit that you're trying to capture in this. I think it's exciting. Sometimes pledges aren't just they can be very little things, but they can also be quite big things that take time. And you need to have a means of capturing all of those, don't you?